The tutorial today is on Eustachian tube dysfunction, ETD. Eustachian tube dysfunction is it's a common problem that usually results in symptoms of stuffiness, difficulty with hearing, a cracking sensation in the ear when yawning or jaw opening. It also is associated with recurrent sinus infections, balance problems, difficulty with hearing as stated earlier, even sore throat, and recurrent allergies. So let's just talk about the physiology. I have this up on the screen and you can get this anywhere, but this is obviously an ear. This is the external auditory canal where you're not supposed to put a Q-tip down. And right at the base here is the tympanic membrane or eardrum. That's the cul-de-sac or blind end. Behind that is where the organs of hearing and the organ of balance are housed. And because this is a mobile, very thin membrane, it has to move. When sound waves come in this way and get furrowed or filtered down into the eardrum has to vibrate with the sound waves and vibrate the bones, and then that stimulates this hearing organ to send impulses to the brain, and that's how you interpret the sound waves and the movement in the air. You can't move an eardrum if you don't have a blow-off valve on the inside. That's the Eustachian tube right here. If this is all blocked, just like a drum with two ends that are closed, if you try to hit a drum with two ends that are closed, you're going to have a dulled sound. If you have an open end, then when you hit the drum, it vibrates and sends a sound almost like a subwoofer in a car out everywhere. So if this eardrum is going to vibrate properly, if you're going to be able to hear properly, you have to have a Eustachian tube that's open. The Eustachian tube is a soft tube. It's much smaller than the external auditory canal, and it's on the inside so you can't see it, but it opens into the back of the nose. So if the nose is not stuffy, if the Eustachian tube is supple and moist, and if there's no snot or discharge blocking the way, you'll be able to have easy access. The eardrum will move. When you go up in a plane and have pressure changes, which is why most of my federal air marshals have problems, because they're constantly in high pressure cabins. When this is blocked off here and the pressure in the cabin is higher, exerts higher force, it forces the eardrum in. And if you can't depressurize, some of you will blow your nose and pop the ears out because of the high pressure, or you'll yawn, and when you yawn it pulls the Eustachian tube open and then it depressurizes, you can hear suddenly. So those techniques are to open Eustachian tube. Now if you have a stuffy nose, a blocked up nose, then you don't have to have complete obstruction. You don't have to have the obstruction to the point of not being able to hear your voice properly or not being able to breathe. You can have partial obstruction in the nose. So patients typically, like my air marshals, will come in, they'll say, I can breathe, and you'll be able to breathe, but the part of the nose where the Eustachian tube drains into, on the one side and on the other side, will be blocked just enough so that this thing doesn't move properly, and it's a setup for pain, it's a setup for problems. So this is where we get to, that's all the functional part of how to get the eardrum to work better, how to get the sound to sound better, and how to get the pain to go away quick. The functional problem is when this is blocked up chronically, whether it's the Eustachian tube that doesn't have enough cartilage in it, or your nose is just so swollen from ragweed, dust, pet dander, harsh air, harsh cold of Chicago. When the nose is all blocked up, what happens is this lining in the middle ear, it's a live lining, it's tissue. It has to be secreting fluid. Small droplets of fluid will usually trickle down the Eustachian tube and then out in the nose. It has to, otherwise your mucous membrane would be dry. When this is totally blocked off, you'll have an accumulation of fluid. It's sometimes in kids referred to as serous otitis. If there's no fever, we don't treat it. We just give the kid, we just say clear out his nose, maybe to decongest it, maybe echinacea, maybe just rinse his nose out with saline and it'll open up. And then when this opens up, the Eustachian tube, after all those techniques of clearing the nose out, the fluid level drops. If you don't do anything, the fluid level is high, eventually a bacteria or two will stay there, develop an ear infection, and there you go. It's a fever, it's painful, and you see a red ear. So again, the idea to beat that is to keep this open. The problem with kids, not to go off course, but the problem with kids is in the skull of a kid, the Eustachian tube actually drains this way. So sometimes you don't have it going to gravity. That's why kids, until the head starts to grow and the skull grows upward and the Eustachian tube actually points downward, the kids get recurrent infections all the time. So that's expected with a lot of kids. That's why it's so important to keep a kid's nose open. It's so important to keep the environment that the kid is in dust-free, pet dander-free, and everything else to clean out that nose as best as possible. The anatomy is different. Anyway, going back to my adults, if you're going to be exposing yourself to chronic air pressure changes, like as my frequent flyers do, it's always important, really, to clean out the nose. There is something that you can pick up at Walgreens, Walmart, Target, the pharmacies. It's a spray. If you spray this into the nose, it uses saline, which is an inert, it's clean in this bottle. It's an aerosolized bottle. If you spray into the nose, you'll actually wet the lining. Any debris, whether it's dust, ragweed, pet dander, grass, anything that's in the nose that's filtered from the entire day will be taken out with the rinse. This is like a douche. So you don't just spray a little spray. You have to actually count 1 1,000, 2 1,000, 3 1,000. You'll probably see it all come out. If those of my guys who are blocked up, or girls who are blocked up, and you spray on one side, it might just all come out. But if you keep on spraying twice a day, every day for at least 2 weeks, it'll eventually open a passageway so it gets to the back of the nose, and it will open things up and get all that crud out of there. Remember, when you just dry blow your nose with a tissue, you can get some dust mite, pet dander, even bacteria. You can get some of it out on your tissue. But if you irrigate first and then you blow, you get a lot more success with everything out, and you also moisturize the nasal passage. Another way that you can do it is a neti pot. Neti pots are found anywhere. You have to get bottled water, you mix it in with the sea salt or the salt compound that comes with most neti pots, and you stir it up. It's supposed to be bottled water because the Center for Disease Control, the CDC, had found one case of a guy in, I think it was Louisiana, that used this with Louisiana filtered water from the Louisiana Public Works, and the gentleman died of a parasite that went into the sinus. I would tell you that that's rare. This is a technique that has been for centuries. It started in India, and it became popular with the yoga craze of the millennium. And you don't always hear Indian or people who practice yoga, people from India or people that use this, having parasites enter the sinuses. It just isn't that common. Maybe for Louisiana it might be, but Chicago, filtered water, tap water is good. I don't think there's many parasites, and I'd be worried more about parasites in drinking water if it came from the tap. Anyway, bottled water, and you fill it up, you put it into one side, comes out around the septum and out the other side. It drips slowly. You usually have to, in Ayurveda or in yoga, it's a technique that you do in the morning and at night, and you do it and you calm down, you breathe through your mouth while you do it, and eventually it's over. It's a way of irrigating toxins from the body. Yoga also does breathing techniques, also has oil pulling in the throat, also has other things like hot temperature yoga, sweating, and they all work to get toxins out. This is just one way to do toxins. If I have my workers who work in the field of grinding metal or cutting, my carpenters, welders even, it's very important that you get all of that stuff that you breathed in out. You would think that grinding metal is okay. It's not, especially when you have amalgams that you're grinding. You're going to inhale and probably swallow some of that stuff, and I'm sure there's silver, there's nickel, mercury compounds. In wood, you would think that'd be okay too, but there's binders in wood, there's glue in wood that you don't want, so everything's got to come out, and it's not going to hurt. You can't overdose on this. So this is, again, a Neti Pot. I'll put a link on the bottom of the video to where you can see this being demonstrated on the Oprah Dr. Oz show. Neti Pots, you can find them anywhere. So the idea is when you use a Neti Pot on one side, it clears out the nose. If the nose is clear and open, Eustachian tube works better. The Eustachian tube is working better. The ear functions nice. And you don't have any of the cracking, pressure pain, difficulty with hearing, and or headache. So that's it in a nutshell, Eustachian tube dysfunction. Again, not all people will have the same presentation, but because of all the pollutants that we have and because of all the traveling that the average American goes through, it wouldn't hurt. In fact, you can't really overdose on these products. You can overdose on decongestants and Claritin or Zyrtec. I sometimes will combine this during bad season with Sambucus or Sambucus and Echinacea or Garden of Life Sinus Immunity. I like that combination to use internally with beefing up your probiotics, using anti-inflammatory, natural anti-inflammatories for the nose. One final thing that I use with people who have chronic headaches or difficulty with the nose, difficulty with ears, sinus infections, Butterbur. Butterbur is fantastic. I'll put down the dosing. It's usually twice a day for about a month to see differences. I think it's a great anti-inflammatory. Also helps with chronic headaches and pain. So that in addition to what I just mentioned are all the potpourri of things that keep my people who suffer from sinuses or ears out of seeing me for an acute visit. Remember, I work in an immediate care center. I can use a whole bunch of prescriptions to make you feel better, but why not do it naturally? And if you know the physiology of what I just explained, then you can learn to beat the symptoms before you have to come in and see me for a prescription antibiotic. Never a problem doing that. If you need it, you need it, especially before a flight. But try to do it naturally.